Okay, this is part 2 of Pediatrics lecture. Before we move into growth charts, I do want to confirm that you understand how to change pounds into kilograms. Most of our pediatric and child doses of medications are going to need some conversions there. So if you don't remember, let me just refresh your memory. In order to find a child's weight in kilograms, what you would do would be to take the pounds, the number of pounds, and divide that by the number 2.2, and that will give you the weight in kilograms. Okay, so that's the number of pounds. So let's say that the child weighs, let's say that our child is going to weigh 27 pounds. So if you were to take 27 and divide that by 2.2, that's going to give you 12.2727 blah blah blah, but we're going to round that to the nearest tenths, so that would be 12.3 kilograms. Okay, so all we did was we took the pounds divided by the number 2.2 to give us our new weight in kilograms. Okay, so now we can move on to growth charts. You know, it's always fun to talk about growth charts. Most of the time as young parents, when we're trying to watch the pediatric folks fill out our growth charts for our children, or maybe we're looking at things in the computer, or how are they measuring up? What percentile are they in? Well, we want them to be as close to 100 as possible, right? But here's what we're doing. We're actually taking our children and we're comparing them in height and weight or length to those of other children of the same age. So the primary use of a growth chart is to look at a child's growth pattern. It's going to help us identify any problems that might be coming along, and then we are responsible for reporting that information to the physician. So that's the biggest thing I want you to remember here. It's all about making sure that the child is consistently doing well. We don't want to see any dramatic fluctuations of drops. That's kind of alarming to us. So as you can see here, again, it says that we are comparing the child's weight and length or height with children of the same age. So they give you a great example. Love this, love this. We have an 18-month-old boy that weighs in the 25th percentile, and he's 80th in in height. So again, that's their weight is in the 25th percentile and their height is in the 80th percentile. Well, what the heck does that mean? That means that 75% of 18-month-old boys weigh more, 25% weigh less. And then 20% of 18-month-old boys are taller and 80% are shorter. So it's kind of confusing, but we want to make sure that this is just a good way to break this down simply. Okay? So we're looking to see if there's a rapid change. Is it up? Is it down? We got to make sure that we report that information to the pediatrician so we can make sure that further testing might need to be done and further action. Okay? Moving along to pediatric blood pressure measurement. This is important, just like we measure with adults. We got to do it. So the American Academy of Pediatricians and Pediatrics recommends that children aged 3 of age and older have their blood pressure measured on an annual basis. Well, what is it doing? Well, it's helping us to identify those children that are at risk for developing hypertension. Yes, believe it or not, children can have hypertension. Children have to take antihypertensive medications. Crazy as it seems, but it does happen. We're going to identify those children. We're also going to identify children with kidney disease or heart disease, and that's what we want to make sure we get ahead of, because the younger they are, we can get ahead of that silent killer and help keep them well. We're also looking at overweight children. Most of those overweight children have a higher blood pressure than our normal weight children. So what do we do to encourage those children to reduce their blood pressure? Well, it's just like we do for any adult. We want them to have some weight loss, maybe a prescribed diet, and increase their physical activity. You know, for children, sometimes that's kind of hard, especially if they're picky eaters. But you got to start small and move your way up. And the parents are in control. You got to encourage them, don't give up. We're finding this early, and we're just going to keep moving forward with it. So when we're measuring blood pressure on the pediatric patient, it's no different than using a cuff on an adult patient, and I know you guys have already talked about that with vital signs. We're going to use the right size cuff. If it's too small, we're going to get an inaccurate reading, and it's going to be falsely high. If it's too large, it's going to be falsely low. So how do we measure? Same as what we do for an adult. That cuff needs to go around the patient's arm, and the bladder of the cuff should encircle their arm between 80% and 100% of their arm, typically about 80%. Okay, so there are different sizes of pediatric cuffs. So make sure if you're working at a pediatric office, that's not a problem. You've got tons of them. But let's say you're working at urgent care. Well, you need to have a couple different sizes of cuffs for your pediatric clients, not just adult sizes. So let's make sure that we do the correct thing and use the right size cuff. Now, this slide actually points out a really good point. Some of our children that are young in age, like they're talking about here, there's an 8-year-old overweight child, they might need an adult size cuff. So don't just look at the child's number, age. Look at the patient. Look at your patient. Read your patient. Use the right size cuff. Okay? So this is our normals as far as the bladder length and the arm circumference. That's really not too important. It's just a nice to know. But again, we want to make sure that we get that cuff to encircle about 80% of the child's arm. Now, how many little kids do you know that will sit still, much less to get their blood pressure checked? It doesn't happen very often. So let me just encourage you, make this fun. Make them understand what you're doing. Show them the cuff. Let them touch it. Most of the pediatric cuffs have pictures on them. And you can tell them, hey, can I put this around your arm? It wants to give you a good tight squeeze and hug, just like your grandma does. And then typically that allows them to understand that it's not going to hurt them. It's just going to squeeze them kind of tough. And yeah, a lot of them get mad because they're having to sit still. And you're going to have to do the very best you can. But give them something to take their mind off of things. Give them that tongue depressor. Give them something to play with, a book, a toy. Have mom and dad help you with that. Make sure they're relaxed. You surely don't want to try to take their blood pressure while they're screaming their head off. It's going to be falsely high, no different than with an adult. Okay? So again, it tells you to reduce the anxiety, explain things to your patient, let them have something to play with. And then of course it brings out the point, just like we do with adults. Make sure you assess that blood pressure after they've been sitting still and quietly for about 5 minutes. Okay? So their blood pressure is going to vary depending on their age, height, and gender, just like with adults. Male and female is a little different. So what are we looking at here? What are we looking at here? So there's this NHBP-EP, the National High Blood Pressure Education Program, that says here are the normal ends. If a blood pressure is higher than 90% to 95% of other children of the same age, height, and gender, that child may be diagnosed with hypertension. And that's kind of scary to think about, but it can happen. So be very careful. Measure this appropriately, and we're going to give those results to the physician, okay? Notice that, just like with adult patients, physical activity, emotional stress, that's going to change their blood pressure, so just be careful, all right? So now we're going to move into some of these special procedures that we might perform with children in the pediatric office. All right, so the first thing we might do is to collect a urine specimen. Now this is very important. As we do with adults, urine can tell us a lot. But now what about these little kids that are in diapers? How in the world are we going to do that? Very carefully. Very, very carefully. We're going to see some pictures and talk about this a little bit more in depth. But what's the purpose of the pediatric urinalysis? We're going to screen for the presence of a disease. This is part of the physical exam. We're going to assist in the diagnosis of a pathologic condition, and we're going to evaluate effectiveness of therapy. So this could be medications to treat other problems. So we do have this cool little thing called a pediatric urine collector. It's used for those pediatric patients that are of the infant and young children age who don't have the ability to give us a urine specimen on demand or voluntarily. So what this is, it is a little adhesive bag that you tape to the external genitalia of the patient, okay? But there's some really important information that we have to remember here. Just like we do with our adult patients, it's very, very important that we cleanse the genitalia of the patient before we actually apply this pediatric urine collector. And that's to prevent any contaminants, just like we do with our adults. And we want to make sure we wipe from front to back, taking those germs away from the urethra, okay? So this is not a hard thing to do. Sometimes it's a little tricky to get positioned just right, so whenever you leave that on them and fasten their diaper back, that it doesn't leak everywhere, but just stick with it. It's not too bad. So now we're going to move into pediatric injections, and I'm going to flip over and stop this recording and start a new one.